So how do you think these environmental factors are affecting people?
Yeah, if you see 2 decades before, the baldness percentage was much less in younger group. Of late, you're seeing more on the stress at workplace, long working hours, job stability is not there. So all these factors are also affecting and not.
Do you think is the ideal age or stage for hair?
Yeah, honestly, there's no ideal age, but theoretically, if you discuss, hair fall can start as early as 16. Loss. So wherever we are doing, because unlike the female males, it's not a completely bald.
Okay.
It's a Christmas tree pattern in the top. There would be residual hair, but it would show.
To be listed on the 3BestRated, and how does it feel to be called the best in the business?
Yeah, definitely it feels good, right? Because getting an award from 3BestRated for all hard.
Hello everyone. Today we are here to talk about a common but often overlooked issue which affects people of all ages: hair loss. Whether you're old or young, male or female, hair loss is a prevalent issue among everyone and something we all can relate to. In recent years, we've seen a rising number of cases in which younger generation is experiencing intense hair loss. This not only affects their physical appearance but also their mental well-being. Questions like what should I do, where should I go, whom should I consult are becoming more and more relevant. To address this growing concern and help us understand better, today we have with us a very special guest, Dr. Ravi Chander Rao, a head plastic and hair transplant surgeon at HairSure. Dr. Ravi Chander Rao is here to share his expert insights into whether hair transplant is truly safe, what are the factors that result in early hair loss, how to prevent it and manage it, and practical advice to maintaining healthier hair. So without further ado, let's dive into this important discussion. Hello sir.
Hi,
How are you?
I'm good, and how are you?
I'm good, thank you. So first of all, I'd like to congratulate HairSure for being one of the top 3 hair transplant centers in Hyderabad.
Thank you very much.
I'm sure everyone is very eager to listen to your insights. So I have a couple of questions with which we can begin with.
Yes, sure, go ahead.
Okay, so my first question is, Hyderabad is a metropolitan city and people have very rushed lifestyles, constantly changing, and with pollution and everything. So how do you think these environmental factors are affecting people hair loss at an early age?
Yeah, if you see 2 decades before, the baldness percentage was much less in younger group. Of late, you're seeing more on the rise. Even if you see like diabetes, hypertension, blah blah blah, any other disease is on the rise. That's because of lot of stress related to the work, and not just that, but the urbanization which has increased the pollution. If you see the air quality index, we are at 250th position globally, and it's 108, that index percentage, which is not good. 50 should be the target, okay? And not just this, the water is pollutant, the food which eat is adulterated. So lot of factors are aggravating the root cause, that is the hereditary baldness, right? Which causes the pattern which we commonly see in the men, and it's on rise in the females also. Stress at workplace, long working hours, job stability is not there. So all these factors are also affecting, and not individually. If you see the person, the lifestyle has changed.
Yes.
We are sleeping less, working overnight, and smoking, alcohol, other habits have increased, and proper nutritious food is not available because we are away from home. Most of the age group, right? They have come from far away from other places and working here. So all these factors combined as causing hair issues.
In the recent years, with the boom of social media and everything, I think youngsters are very conscious about their appearances and all. And especially this has an effect on their self-esteem. So in this era, hair loss is even more of a concern. So keeping this in mind, how do you think the perception of hair loss and hair transplant has changed in Hyderabad's youngsters?
Yeah. If you see olden days, baldness was much less, and older people were getting it done, and they never felt it as a problem, right?
True.
It was a natural thing. Now with the social media and other things, and younger population getting affected more, it has become a huge issue, right? Looks are considered more important when you have to put it on a Facebook or Instagram or a DP, or if you are in a meeting or presenting or going for a job, looks are considered more important. So baldness has become an issue for them, right? And previously, if you see, it's only for the cosmetic surgery was only for the rich and celebrities. They used to go out of the country or some places where it was available and getting it done. Now that with the advancement and globalization, even these techniques are available right in the heart of the city, that is Hyderabad. It's more advanced than other countries, if you see, right?
Now that you have mentioned, even I've heard a lot of people traveling to places like Turkey and USA for hair transplant. But now having a center in Hyderabad, what do you think it means for us?
Yeah, as I told you, right, globalization and with advanced techniques which are available right in Hyderabad, there's no point going to Turkey, because not just that, getting a transplant, but post follow-up is also more crucial. So if you are in Hyderabad or an NRI, coming to Hyderabad is easier to have a follow-up and continuous, because baldness is not just a static thing. You get it done and it's done. No, it's a dynamic thing. You need follow-ups, further checkups, and further procedures also. So getting it done the same quality and same perfection, it's better to get it in Hyderabad than other places.
Since you have mentioned about post-care, sir, could you expand more on it?
Yeah. Hair transplant, once you get it done, right, it's not just finished. You have to be having regular checkups, because post hair transplant, there will be shedding phase. You will be psychologically stressed out, because what's happening, I'm having a better look at 2 weeks. Now after 1 month, I've lost hair. That's a stress loss. Okay. So if you are in contact with your surgeon, and if there's some issues, they can always solve it. It could be a WhatsApp call or a personal visit. And post-op care, it's not just hair transplant, but continuation of medications and proper follow-ups and regular checkups are needed for this.
Okay. So what do you think is the ideal age or stage for hair transplanting for best results?
Yeah, honestly, there's no ideal age, but theoretically, if you discuss, hair fall can start as early as 16. Okay. Once it starts to show, it could be like 2021, but we don't suggest at that stage, because we're not sure what stage you would go, right? So initially we prescribe medications and try to stabilize them. By 23, 24, we get a fair idea, right? What stage you would be going, or at least you would be in an understanding, right? That it's a continuous process, baldness, right? And it's not stopped. So getting done at early stage, like 1 or 2 grade, he would need a hair transplant in a near future. So this frontal recession is common for males. Unlike the females, there is a U pattern. Younger age group, at like 20, 21, they want to just correct that. We usually counsel them that's not ideal. You can continue medications and postpone it. 23, 24, yeah, more or less they would be in an understanding age group. And if once it is done, right, 28 to 35, more or less they would get it done for the matrimony reason or a job or self-confidence or whatever it is. And 35 to 40 or 50 years is for the position they are in. If they're in a CEO position or in a manager or higher post, they want to look confident when they're present or addressing a larger group. So each stage, the baldness is different and the person needs are different. So based on that, we assess and suggest them. For some, they want to get it done at the earlier age. They don't want everyone to know that they're going bald and then getting it done. For some, they're okay with completely bald. I want everything at one go. I want to go to 5 or 6 stage, then I want to get it done. So there's no ideal age or stage, but it's on individually you have to assess and suggest a hair transplant.
What about the over limits, sir? Like at what age do you think they should not go forward for?
Ideally, there's no over limit. If the person is fit emotionally and physically, he can get it done. And we have done it for a 75-year-old who was a military guy, and he could do like 50 push-ups.
What about other health conditions, sir? Is there anything we should keep in mind? Like we talked about diabetes and like
Right.
blood pressure and all those effects.
So before getting a hair transplant, we usually evaluate every client. His sugar levels are under control, his BP is controlled, other medical issues also, like thyroid, and if you see females, the anemia, all other things are corrected, then only you plan for hair transplant.
So how important is post-transplant care?
Yeah, getting hair transplant is one end, and post care is equally important for a successful outcome, right? So we specially give a post-op leaflet to them and strictly ask them to follow it. Like a few things like physically getting damaged, right? Getting into a car or a low roof. Physical damage would uproot this transplanted. That's the foremost important thing, not to injure your hair. So the same way we ask them to avoid physical exercise, at least for a week. Rigorous exercise like running, walking is okay, but running or heavy weights, those kind of things, especially doctors, orthopedician we see, right?
Yes.
There's a C-arm instrument or light, they get injured. We ask them to take at least 3 to 4 days of rest. That's crucial for the successful outcome. Otherwise, if you get injured, then that's going to damage your transplanted. And sleeping position is also important. If you get it done on a vertex, right, you have to sleep it on a sides. If it's a front, make sure you recline on the back. If you're sitting and watching your mobile or on a laptop, there could be a lot of swelling which can descend onto your eyes and look scary because there'll be swollen forehead and eyelids. That could be scary, but it's normal. Like, it would vanish in 5 days. And regular hair wash is important with the prescribed shampoo, what we're going to give it to them. And keeping your hair hydrated, like sprinkling water for first couple of days. And the prescribed medications, what we give for 3 to 5 days, you have to use it.
Okay. So what about hair care routines? Like any care routines that we have to avoid or anything we have to follow?
Yeah. Once the transplant has been successful and your hair has grown, right, you have to treat it like your regular hair. You can cut it. Any styling is also okay. You can hair color, or it could grow like your original hair. Right? But as a general thing, we usually ask them to avoid traction. Okay. There's something like traction alopecia, which can happen. Once the hair has grown, right, you can treat it as your original regular hair. Right? But cutting or shaving is okay. But as a general thing, rule, avoid traction and heat styling things.
Sir, in all these years of experience, is there any case that you've dealt with which you find very intriguing or challenging?
Yeah, we've been doing this for almost 15 years and we've dealt so many complex cases. Like one interesting I would like to share, this young kid who a mother got him, right? This guy was socially recluse. He sustained this burns in his childhood. So everyone was bullying him. So he never used to attend any functions, only to go to the school with a cap. Everyone used to label him as a cap boy. More than half of his scalp was burnt. So it was a challenge because there's hardly anything left for us to transplant the entire area. So we have done this interesting case, which we call it as a balloon thing, which we keep it in the scalp. Expand it over a period. Like in a pregnancy, you expand your skin or slow period, 9 months. Same thing, we keep a balloon, we expand it over a couple of months. The expanded skin, once it is done, then we remove the balloon and drape it on the burns. We have done this balloon thing twice. We covered more than half of his scalp. There was some amount of left, and his eyebrows were also completely burned. So we did a hair transplant for the residual bald area that is burnt because of burn thing and eyebrows thing, and his eyelid also was burnt. So he was not able to close it completely. So we released it and put a graft, eyebrows all together, and his mother was so happy to see him. Right, and he was so confident that he could get some job, and he came after a few months with all this result and to share that happy story to us with a sweet box.
How did you feel about that day?
Yeah, super happy. Whole team was actually joyous to see this guy smile,
Yes, that's
getting
wonderful.
a smile on his mother and him.
Yes. Moving to women, what are the common causes of hair fall for women, and how effective do you think the treatment for them is?
If you see women, like as they are complex, hair fall is also the same. Fall is more common than we perceive, right? And having a long hair, voluminous, lustrous hair is considered as a beauty.
True, true.
So people wouldn't accept or herself, going out with a bald,
True.
right? So it causes a lot of stress onto them and anxiety and depression. So you have to evaluate overall. Like unlike males, the commonest cause is the hereditary ones. Like females, there are a lot of factors. Like internally, if you see, there could be anemia, hormonal like PCOD, these kind of nutritional deficiencies, or post pregnancy. We have to evaluate in toto with few investigations and check. When you do a trichoscopy, you get a fair idea. It's a generalized or a localized cause.
Okay.
So when you get all the investigations, you have to treat them accordingly. Correct them with the nutritional deficiencies. Give them like minoxidil or spironolactone, anti-androgen treatments like these things, depending on the age group, and correct all this medical line of treatment would benefit them.
Okay. So what is your opinion about hair transplants for women?
Yeah. Unlike male, the women getting hair transplant is less, because I told you like the other factors which are common, which you treat them, they get back or regain the hair, right? So the complexity of hair transplant in women is like you cannot shave. No one would accept, because for them to go back such a long hair would, especially in Indian, like, it would be 2 to 3 years. So we have to do a long hair transplant for them. And there's a thing called stress hair loss. So wherever we are doing, because unlike the female males, it's not a completely bald.
Okay.
It's a Christmas tree pattern. In the top, there would be residual hair, but it would show the partition more.
Okay.
So in between the hair, we have to transplant. So when you do this transplant, the in between hair undergoes some stress loss. There could be a bald patch kind of thing happening, post procedure.
Okay.
So they have to hide it. And maintaining a long hair is not that easy. So they have to have a hygiene, which has to be done at the clinic, and post procedure also they have to maintain.
Okay. Sir, is there any advice that you'd like to give to people in their 20s who are experiencing hair thinning?
Yeah. As I told you, like, because of social media awareness, everyone thinks they're going to baldness.
True.
Any person who's coming at 20 would have a slight recession. When you're 16, both male and female will have a U pattern hairline.
Okay.
Once a male matures, you'll have a M pattern.
Okay.
Right? That's natural. If it deepens, then you consider, okay, they're going to bald.
Okay.
So, slightest of recession, they tend to fear and they approach us asking for a hair transplant, which we strictly say no. Because if you get done at this age, unfortunately, if you are going bald, this would stand out and give an unnatural look. So you have to keep chasing your baldness.
Yes.
So strictly no for 20. Yeah, we have to evaluate these kids whether they have any family history of baldness, any nutritional deficiencies, or they're under a lot of other issues like medically. Assess their hair fall and prescribe them medical line of treatment like minoxidil. Finasteride is optional.
Okay.
Yeah, if it's not getting stabilized, you can advise them the exosome therapy or GFC, PRP, laser, low light lasers. Till 23, we usually don't suggest them to go for hair transplant, because we are not sure what stage of baldness they would end up.
True.
Ultimately, having a donor is also important.
Yes.
At times we give them all this instruction and strictly say no. They think that we are preaching and not giving any actual treatment, and they give 1 star to us.
So has there been any recent buzz or media coverage about hair transplanting that you found noteworthy?
There's a lot of hair fall rise population. So is the market on the social media trying to capture this.
Yes, true.
If you see like any Instagram, once you search hair fall gone, you will be bombarded with all these oils which proclaim to go back your hair. But if it's genetic reason which is you have lost hair, there's nothing like think medically with the medications or these oils to go back.
Okay.
Only hair transplant is a solution.
Okay.
So on a serious note, if you see, like there's a lot of research going on for decades over this regeneration of new hair. That's cloning, which is more promising with the newer scientific things which you could see, right?
Yes.
Probably in a decade or so, we can grow this hair that can have a solution for people who have less donor.
Okay. So then multiple hair transplant centers all around the place. So what sets HairSure apart from them? Why should we choose HairSure?
Yeah, of late, there's lot of clinics which have mushroomed out. Even the salons started to doing hair transplants. In most of the centers, it's run by a single doctor or a technician who does majority of the work. Our the only center which has 8 surgeons performing and monitoring the whole procedure.
Okay.
We are pioneers in SHI technique, which is
Okay.
the only technique which reduces the operating time and the yield or the success of the surgery increases.
Oh. So what are the qualities that you think that build this level of trust and success for your organization?
Yeah, our results speak for our success, and most of the patients, they send their own relatives and friends. That's how we have grown, not just because of the marketing. Our clients are our brand ambassadors.
Okay, that's
Yeah, surgery itself is so stressful for the client, so we try to maintain a friendly relation, not just in the OT, and post procedure also we try to maintain that rapport and relieve them of all the doubts and any hiccups they face.
okay. Now we've almost come to an end. We have one last question. So how does it feel to be listed on the 3Best Rated, and how does it feel to be called the best in the business?
Yeah, definitely it feels good, right? Because getting an award from 3Best Rated for all hard work you have done, at the same time it gives a sense of responsibility to deliver even more.
True. Thank you so much, sir. Thank you for your time and your valuable insights on the topic of hair loss and hair transplant. It was wonderful meeting you. And we hope that you gain more achievements in your field, and also we get more opportunities to meet with you and discuss more on this topic.
Yeah, definitely. And thank you very much. Yeah, it was nice talking to you, and thank you.